Okay. All right. We are on, my friend. So welcome everybody. This is Brendan from the Exercise Therapy Association. And today I have with me Master Physiotherapist Arthur Cuenco. So I met Arthur a couple years ago. And Arthur is really a lifelong learner who is super passionate about his profession. So Arthur graduated U of Ottawa in '99, started working as a physiotherapist in the year 2000, and now he serves as a coach, a mentor, and an educator to about 200 physiotherapists through Physio, which is a company he partnered with. In addition to that, he's a father, he's got a beautiful family, he balances all of these different things, and he's always educating himself. So Arthur has taken just about every therapy course you can think of, whether it's active release, dry needling, Graston, all the different techniques you can think of. So he's constantly learning, and he's just an extraordinary soul, just an awesome all-around guy. And we're very honored to have him here today because he's going to take his wealth of experience and his wealth of wisdom and knowledge, and he's going to be sharing it with all of you today. And in doing that, you're going to have some information that's going to help you to succeed in this new world that we're all entering, which has a greater reliance on virtual care. In addition, you're going to be able to get some practical insights and wisdom to learn how to specialize and combine your passion with your profession. This part will largely be building off of concepts that Ken Kanakin shared with us in a previous interview for those who were there. So we're going to be taking the ball of wisdom Ken Kanakin gave us and running with it there today. And he'll be answering any questions that you might have. So if we've got, I'm just double checking on the Facebook Live here. If you do have any questions, then please just shoot them into the comments and I'll be sure to bring them up with Arthur, and we can pick his brain here today. He's generously offered to share himself to help better all of you here today. So Arthur, first of all, welcome. Thank you very much for being here.
Thanks for having me, Brendan. It's nice to see you again virtually. You look good.
Yeah, virtual high five, man.
High five, there you go.
There you go, bang. That's a thing.
I want to give a shout out to all my Exercise Therapy Association friends and anyone else who's listening. You know, it's a great opportunity to be here with you and kind of get used to this new platform of communication. I think that it's something that is going to be part of our future, and we all have to embrace it however we can. So I think that this is a great way to give my experience, my story of what got me into my profession, how I looked into getting specialized, and then also just some of the great things that have been happening over the last month with this introduction of virtual care and physiotherapy. So thanks again for inviting me, Brendan.
Absolutely. Now, for those of you those people who may not know you as well, or those people who may not know this part about you, I was wondering if you could just share a little bit about your story, you know, how you ended up doing what you do for a living. What has your journey been up to this point? And you can dial this back as early as you want.
Okay. Well, I can definitely dial it back as far as when I was a kid. And
okay, great.
To remember, you know, first of all, I love sports. I grew up playing a lot of tennis. I was a sprinter. You know, I played a little bit of soccer. And, you know, I was always really athletic. And one of the things that I loved to do was to jump on my mom and give her a big back massage. You know, say, oh my God, one day you are going to be like, you know, a master at what you do, but you're going to use your hands, that's for sure. You know, and I twinkled around with the piano. You know, I was really good at origami. You know, I did some martial arts as well. And then of course with the tennis, but you know, it led me into the profession of physiotherapy, but how it did was kind of neat. It was very similar to Dr. Ken Kanakin's talk. I was a competitive athlete. I played a lot of racket sports, primarily tennis. So I knew my body well, I knew how to move and that sort of thing. But of course, tennis was not the sport when you're in, you know, sort of like early high school. to be able to meet people, to socialize, you know, these kinds of things. So I joined team sports in school. So I joined basketball, I joined volleyball, I joined some of the other team sports just to have that connection with people. And then what had happened was we were at practice, and I was going to spike a volleyball. And I was on the left side of the court, so I was on power. Normally, you know, I could reach around, I'm right-handed and kind of hit it like this, but I decided to hit with my left. And what had happened was I landed really funny and I heard my knee buckle. And we all know what that means when you buckle your knee, right? It means you get back up and you keep playing, right? No, it doesn't. It means that you probably tore your ACL.
You tricked me. You got me. 0.1 Arthur.
So I ended up going to see a sports doctor, sports medicine specialist, and that person said, well, you're going to need surgery, or you can do this thing called physiotherapy. And I'm like, anything to keep me from getting surgery, I'll do. So I ended up getting some sessions of physiotherapy, and that really helped me. And it really kind of got me back to playing sports, not at the 100% level, but enough to really enjoy it again. So it was, you know, around grade 11, grade 12, and I was thinking about what I wanted to do for university. I applied for medical school, I applied for biochemistry, and physiotherapy was actually one of the things that I applied for, and I got in. I got this great scholarship, and I said, okay, I'm going to do it. So I went to Ottawa U. The challenge was that I'm an Anglophone, so I had to work really hard to pass a French proficiency exam. And then once I was able to get through that, then I got in, and I challenged myself through those 4 years of doing everything in French. My French improved, my knowledge of the Franco-Ontarian culture also developed. I met so many awesome friends, and just, you know, it was a great experience. But what happened was, when I was in about third year of university, I decided I was going to get that surgery. So I went for the surgery. I went for some physiotherapy. It wasn't at the university, it was somewhere else. And at that time, that was supposed to be the best physiotherapist in town and physiotherapy clinic. Unfortunately, the physiotherapist said, well, I know you're a physiotherapy student, so I'm going to let you be the one to take care of your exercises. You know, I'll give you the sheets of paper, and you go ahead and do it because, you know, you're a student. It's good learning for you. Well, that was really the wrong move, because I did get better. I did not do my exercises. I had nobody to oversee what I was doing, and it just didn't get where I wanted to get. So long story short, when I graduated, I said to myself, I'm going to be more like that physiotherapist who I first met that got me through it. But I'm not going to be like that second physiotherapist who basically just left me alone and assumed that I could figure it out myself. So right away, after graduation, I took a little bit of time off, and then I went to work March 2000. And ever since then, my primary goal has to treat everybody as individuals, that each case is different, that this is not a condition, but I'm dealing with a person, not an injury. And I think that over those 20 years, not only have I developed more friendships and more great relationships, but I've also really have learned that sometimes there's more than just the physical. There is the mental side of things. You know, you talk a lot about it with your mental toughness. There's definitely the emotional side of things. You know, we in North America, the way that we describe pain is through just using the word pain. If you go to some of the other parts of the world, if you go to Asia, if you go to some of the other Europe, the way that they describe their sensations can be very specific. They feel a burn, they feel a dullness, they feel an ache, they feel, you know, a pressure. They're able to describe it in their language, but we just basically say pain. So it's up to us as therapists and as educators to be able to pull that up. So that being said, I met a really great man who is the founder and president of Physio. And ironically, he was the one who was, he was doing some work in a church while I was doing my final project in physiotherapy school. And I met him very briefly. And then when I went to do my interview for my job back in 2000, he said, I remember you. And I said, really? He said, yeah, you were the one that did that project in the church and you were working with the priest and doing some testing. I said, yeah, that was me. He said, perfect. I'll give you a job next week. It just,
wow.
Yeah. he just had this sense. And then, so from that, thankfully, there was a physiotherapist who had a full caseload, and her sister was a doctor, so she kind of moved. So Monday morning, imagine me, a rookie physio, with a full caseload on a Monday morning. I mean, that was unbelievable. However, I would say that initiation was probably the best thing that happened to me, because, you know, I had to, if I could deal with that day, then that means I could probably deal with any day after that. Mm-hmm. So myself, I worked really hard. I worked 10-hour days, and I got lots and lots of education and mentorship from the other physios around. And this gentleman here, his name is Nasser. Nasser said, Arthur, there's an opportunity to open up a clinic in the west end of Ottawa, and I would like you to be my partner in that. At that point, I think you probably only had about 3 clinics. So at that point, I said, let's do it. And the reason why I did it was because I had already been teaching tennis in that neighborhood. Yeah. So I knew a lot of the people in that community. So I could hopefully, you know, let them know that if they were injured or if they needed any help, that there was an option there, that there was a familiar face that was working in that clinic who knew tennis and who was also a physiotherapist. So from that point on, I just continued, and I worked hard, and I put my head down, and I worked very long hours, and I just, you know, really tried my best. Now, the thing is that, and this sometimes happens to rookie physios, and this could be applied for all practitioners, is that you feel very responsible for your client or your patient's well-being. Mm-hmm. Meaning, you know, if they're in pain and they come back the next day, it's like, it's your fault. You feel like it's your fault. So what do? You go in the books, you reevaluate, you spend more time, you try something different, and then that doesn't work, and then you're really hard on yourself. And those are the things that really bring you down. And what I realized was I didn't want to be that kind of a person. So I had to fight myself to say, just let it take its course. Do a few sessions, keep going. Maybe there's some mental toughness that you have to think about. And, you know, and hopefully with time, things will get better. And you know what, Brendan? Things started to get better. And I would say that 6 years into my career, I followed that path. I kind of did the same thing. I did some passive modalities, a little bit of friction massage, some passive range of motion, these kinds of things that most physiotherapists do. I took some acupuncture courses, some early McKenzie techniques, some more basic manual therapy. And then I realized, like 6 years into my career, I need to specialize. I need to do exactly what Dr. Ken Kanakin said. So I said, okay, what am I going to do? What course can I take? So that's when I got exposed to ART, or ART. Yep. And ironically, that technique, which is the gold standard of soft tissue management, was the thing that really got me through 14 years later. But what I can say is that the reason why I took ART was because it sounded like my name. So it was like,
That's the perfect reason for any major life decision, Arthur. It's like, you can also take virtual art classes online now. Did you know that? It sounds like your name too.
Well, that's it. So anyways, it was about saying, if you didn't remember who I was, just remember what I did, and then look me up, art with art, you know? And I met this also a great sport medicine doctor whose son and buddy turned out to be these great physiotherapists also in Ottawa that have kind of created their own movement. But this particular sports medicine doctor, he and I were kind of like thinking about a great way to kind of tag that art with art. So we came up with the art of healing, the ART.
Okay, that's
right, so I put that on my business.
I like that. That's good. That's smooth.
So anyways, so the active release, you know, I've been actively certifying and recertifying and get educated every year since 2006. And then I got into other techniques. I got into the Graston technique, where you were using this stainless steel metal instrument to scrape the myofascial tissue. Got bigger into, you know, dry needling, intramuscular stimulation, acupuncture, traditional acupuncture. I have this mentor who's a phenomenal acupuncturist, and the way that he explains things and connects things has been really integral. So what I can say is that over the years, Brendan, I really focused on the application or manual therapy side of providing the care. And so at a certain point, I could say that, I probably had every certification when it came to manual therapy, right? Mm-hmm. But I realized that there was something missing, okay? And, there are different kinds of therapists. You could be an excellent communicator, and you can talk to somebody, and you could probably talk them way through getting better. Yep. There's also somebody who's very good technically. You take your modalities, you take your, the different techniques you have with your hands, and you just apply it to everyone. You use everything on everyone, and yep. Probably you'll get them better as well. But the kind of person who you need to become is that person who knows how to think outside the box. The person who knows that you need to analyze the situation. You have to look beyond the injury. You have to look at what other factors are involved. Mm-hmm. When I came across with more of the functional testing. So I got into the SFMA, selective functional movement testing, and learned a lot from those guys. And they have all these great algorithms, to really help us decide, okay, is it more of a, is it a joint mobility issue? Is it a tissue extensibility dysfunction? Or is it a motor control stability issue? And those are like three main categories, right? So yep. It helped me through my thought process of going through things. And one of the other highlights that I learned from them was that, you need to be able to test, you need to create a baseline, then you need to do some kind of a treatment, and then you need to retest, and you need to see if what you did made a difference. And if it made a difference, you keep going. If it didn't make a difference, then you look somewhere else. Now, going back to when I was a rookie physio, thinking, well, that's what I was doing to begin with. You also have to realize that I was already, about 10 years, 12 years into my career, and I had a little bit more knowledge and kind of understanding of when to say, okay, I think I'll change things, where I didn't have as a rookie, right? So that sort of changed my path with how I would approach things. And then I really tried to enforce that with my clients. So that was awesome. I continued with that path. And then all of a sudden, I realized, you know what? I'm a really good manual therapist. I'm really good at, doing testing and retesting, these kinds of things. But there was something that was missing. Okay, there are these great people out there in the fitness industry, and I need to meet them. I need to be mentored by them. So I did some.
Richard Simmons? Was it Richard Simmons? I knew it.
Yeah.
Into the oldies. That's how you got involved in that.
So anyways, so then I came across you, and I came across your system, your troop of followers, and I said to myself, that's the guy that I want to meet. That's the guy that I want to learn from. And that's the guy and his team that I want to be a part of and be a part of that family, because there's something special about him. The same way that I recognize that the founder of Pro Physio was special. The same way that I recognize that some of my tennis idols were special. The same way I recognize you. And so I'm a big shout out to Brendan Fox. He is.
Oh, well, thank you. I'm just very grateful, and any success that I may have, any perceived success, is a reflection of the success of many other people around me, more than anything. So it's just an honor and privilege to be able to do what I can.
And I thank you for that, Brendan. And like I said, there are people that are great talkers. And you, my friend, are one of those awesome talkers. You are a leader, you're a presenter, and you know what to say and when to say it. But you also provide substance. So in what you present, you have the necessary content to break things down, to determine if something is one thing versus another, if in providing exercises can be done to help the person or maybe harm the person. You've got the tools that you've developed, and I know that you're continuing to develop them. And the other thing that you do well is that you look for feedback. So I like the fact that you send out information and you look for feedback from the exercise therapist, from health practitioners of all levels, and you take those humbly and you modify them. I like how you've got like 8 versions of the pelvis press or something like that.
It's never ending. It's
So
never
yeah.
ending.
Anyway, so that's sort of the path that I've taken sort of with my career. You know, I started off, I did a lot of passive modalities. I was very timid with my manual therapy skills. Then I got better at those manual therapy skills. Then I got it more into the assessment and reassessment, functional movement. And now my passion, if you will, is more on the exercise side. And I can say that the relationship that I've built with you, as well as your team, as well as all the exercise therapists that I've met over the courses, has really strengthened my belief that specializing in a particular discipline makes a lot of sense, right?
Mm-hmm.
But we all have to realize that, and this is one of the expressions that I always believe in, I've always taught my kids, that the expert in anything was once a beginner. The expert in anything was once a beginner, which means that we need to give those rookies a chance to grow. We need to give those newbies a chance to develop themselves. So, Dr. Ken Kanakin was talking about, taking the specializations and bringing everybody together. And I think that that's phenomenal. And I'll be honest with you, I remember when I was a new physio or a new tennis coach, and I was among, the greatest, mentors of that industry. Honestly, I was really, really intimidated. But when one of them would come up to me and say, "How are you? My name is so-and-so. It's really nice to meet you. What can I do to help you? What can I learn from you?" Then at that point, it really brought up my self-confidence. So I would challenge the industry and say, you guys, while you are kind of in limbo and waiting around, find somebody that's new to your profession and help them, mentor them in some way, introduce them to the Exercise Therapy Association, introduce them to some of the courses that you took when you were first out there, or the ones that you found helped you. And you will see that that will pay back enormously, not directly, but indirectly with the community and in the world, because we need to pay it forward. Everything that we've learned, we need to help others. So from a professional perspective, I would say that we, over the years, are learning and improving ourselves and passionate about ourselves. But we also need to be a voice and be those big brothers and big sisters to those other people to help them kind of flourish and learn, or else they're not going to do as well as we want them to be. And then the industry is done. There's no legacy.
Mm-hmm. First of all, I just feel like giving you a standing ovation here on all of that. I feel like I just watched an awesome TED Talk right there. Like that was I know you didn't rehearse anything and this is all off the cuff, but that definitely seemed like an awesome presentation you just gave right there. Couple key things that I really loved is talking about looking beyond the injury was one of your major things that you learned, focusing on the person, not the injury, being a big learning lesson. This whole concept of reaching out to a rookie, I think is very powerful because, even, business author Stephen Covey would say that when you have to teach something, you learn it on a deeper level. So whenever you're teaching, you're also articulating to yourself your concepts and you're refining them to yourself. So when you have to articulate it, that it helps you become more clear on your current wisdom. And so it actually helps you calibrate and come into your greatness in other ways. And there's lots of unspoken benefits to that. For those who believe that this is an existence of cause and effect or karma, that you are, building some positive karma for yourself. And I know that for myself, I've always believed in this concept. And it's really funny because, one of the exercise therapy instructors is Lucas Labriola, who first visited me as a university student so I could help him out and coach him and stuff like that, just on my free time. And then now he's one of our instructors, but that was just a rookie I was helping out, and there's, and I know that like even there's many examples from my career where I've taken that approach and it has been extremely beneficial in terms of, you know, developing a great friendship with somebody or a great, you know, collaboration and network with somebody. So there's definitely been some awesome experiences I've had with, you know, reaching out to a rookie, as you would say.
Thank you, Brendan, for that. One thing that I also want to also make clear is that when we reach out to those people and when we help them, you know, sort of better themselves, we have to realize that a few things. Number one, they could end up being better than you, more successful than you, and that's okay. Accept it, right? Be humble about that. And secondly, they may not end up working with you. They may end up opening up their own clinic or their studio, and that's okay too. So my only advice to those rookies is be respectful to your mentors. If somebody is giving you some advice and some education or just, you know, a helping hand, then be professional when it's necessarily time to be professional, right? You know, and I see it sometimes in different industries. You know, it's like one person helps another person who learns all the tricks of the trade, and then they basically open up their own studio or their own clinic that looks very similar to that one. And you know what? That's okay, because that means that they probably learned something good from you.
Yeah. So
be humble about it, because right now, I mean, I'll tell you, like every morning, my family and I, we wake up and we go for a walk, right?
Great.
And we have to get some oxygen. We have to, you know, have a little bit of family time. And we'd see people, and literally, like, people have their heads down and they're afraid. And there's this sense out there that, you know, people are afraid to connect. They're afraid of having, you know, sort of like face-to-face relationships or friendships. And I'm not saying that you have to go face-to-face.
Mm-hmm.
As long as you keep your social distancing, as long as you respect the rules and everything, you know, you could still look at somebody and give them a smile or wave, be nice. I mean, this is who we need to be. And if we follow those rules or those sort of expectations of us, then we will all respect each other, and it will be good for us in the end. Now, one of the things I would like to talk a little bit about, going back to sort of the professional side of things,
yep,
if you mind, is a really cool course that you and I took. It was a course we took on using, you know, sort of these stimulators to stimulate and destimulate different systems in our bodies. And one of the
electrical acupuncture.
Yeah. Because
I felt like we should clarify that once you started talking about stimulators on the body. I'm like, electrical acupuncture, Arthur.
Yes.
Let's be professional here. Don't be telling people you took a course like that with me.
Okay, don't worry. You weren't the only one there. Lucas was there too. I remember Lucas was there. Anyways, the reason why I wanted to bring this up is that one of the things that I learned about them were scars in the body. And I don't know if you remember, but that was really important to me, because when you're trying to do an exercise with somebody, right? For example, if you're trying to work with, you know, a person that may have had a mastectomy, or maybe they had an inguinal hernia and you're trying to get them to squat, or you're trying to do some kind of like rotator cuff exercise with somebody that had some scar from an accident or something, then you have to realize that scars can actually affect one's performance.
Mm-hmm.
I'm not going to go too much into the sort of the physiology, neurology of things, but really what happens is that you have these two different systems. You have the sympathetic nervous system, and you have the parasympathetic nervous system. So the sympathetic nervous system is kind of like your fight or your flight, right? It's kind of like, you know, you're like this and you're ready to attack somebody, or you're ready to, okay? And what do you think happens to all your muscles when you're like that? You become very tight. Mm-hmm. You also have what's called the parasympathetic. And the parasympathetic nervous system is the one that's more about relaxation, okay? It's more about being calm, meditation, you know, yoga, things that could really calm your mind and calm your soul. Now, how does that kind of impact scars, or how does scars impact those systems? If you have a scar, the scar will increase the uptake in the sympathetic nervous system.
Yeah.
Which will mean that there is something going on constantly that's making that stress happen or that tension happen. So unless you do something to that scar, whether it's through friction massage or some kind of manipulation on it, then you'll still have that uptake. You want to bring it down by increasing that parasympathetic system. So this brings into the next sort of topic I want to talk about, which is about diaphragmatic breathing. Okay, people don't know how to breathe. You've taught this in your course. We've taken these in other courses. People breathe like this. They use their accessory muscles. We spend our time sitting, especially those that are at home that are sitting too much. You need to learn how to do diaphragmatic breathing. You need to be able to expand your lungs forwards, to the side, and backwards. And we have these excellent trainers out there and specialists that teach diaphragmatic breathing and the impacts that things like that have. We have specialists in pelvic floor therapy. I know that there are some of the trainers in Ottawa who are fantastic at pelvic floor therapy for both females and males. You know, we have touchy subjects like incontinence issues, problems with, you know, sort of sexual dysfunction. There's a lot of different things that are not really being spoken, and personal trainers through education, as well as some of the other people, can make a difference. It's just a question of getting educated and understanding, you know, sort of how that body works in order to.
And I think just to tie this into your original concept, you know, you talked about looking beyond the injury. And I think really what you're doing now is unpacking some of the things you might find when somebody shows up for maybe a rotator cuff problem, that you identify that they've got a previous injury or surgery with scar tissue in the area, might be creating an electrical disturbance, hormonal disturbance. It might be a constant irritant to the area. So if you're just treating the injury, you're missing this culprit here. Or maybe they're grieving over the death of a loved one or something, and as a result, they've got a very inverted breathing pattern. They're all chest breathing instead of diaphragmatic breathing. So these are some of the factors for those trainers who've just tuned in. If you can look beyond the ache or pain and look beyond the injury, as Arthur's alluding to, these are some of the unique pockets of wisdom that you can specialize in to kind of have answers for people that may not be getting results through traditional methods. And in that way, you can really make a difference for somebody.
Good. And to extrapolate on what you're talking about, one of the other concepts that I learned, and this was actually taught by a massage therapist from Boston, and also phenomenal guy. The way that he saw things, the way he assessed things was awesome. And he really introduced me to a concept developed by Thomas Myers, which is called the anatomy trains, or what we call regional interdependence. So when you were in kinesiology school, and I was in physio school, and we learned at the different muscles, we learned them as compartments. It's like you had your hamstrings, you had your gluteals, you had your nemeus. Everything was in parts, right? Origin, insertion, innervation, function. That's how we learned. But then
I think they still teach that.
What's that?
I think that's the way they still teach it, actually. You know,
no,
that's actually what they teach right now, Arthur. They're not teaching anatomy trains in school.
well, it took me about 15 years to finally learn it. Anyways, so the way that anatomy trains concepts is that we have these myofascial connections. Everything is connected in our body. So as you were talking about before, you know, if somebody presents with one particular issue, that may not actually be where the source of the problem is. It was kind of like that really cool analogy that Dr. Ken Knacken gave about, you know, the steering wheel vibrating, but really it wasn't the steering wheel, it was actually aligning the tires that were right? So it's the same kind of thing. You have to figure out where the origin or the source of the problem is. And this regional interdependence means that we have our muscles and our soft tissues that are all connected to each other. And we also have our joints that are also connected in some way. And then of course we have that neural system that is also very important. Now how that relates to you, I'll give you a practical example. So one of the other professions that I have is I'm a tennis coach, right? So I like to take tennis injuries. You know, like Dr. Ken was saying, he'll spend more time with his weightlifting crew. I'll spend more time with my tennis crew. But what happens is that somebody came in because they were suffering with elbow pain, right? And it was kind of like right on that lateral epicondyle. So it was on the extensor carpi radialis longus and brevis insertion point. So it's kind of classic tennis elbow. So they went to a physiotherapist, tried doing some ultrasound, a little bit of frictioning, these kinds of things. And then the physiotherapist maybe treated them for about 3 months, sort of passive modalities, not much change. Went back to the doctor. Doctor sent them to a sports doctor. Sports doctor said, oh, there's this guy named Arthur, and he's a tennis guy and is a physio. I want you to see him. And then the person went to me and they're like, okay, you know, I'm going to go see you, but I don't know what you can do for me because I've tried everything else and nothing's working, right? So anyways, I went through my assessment and then I determined that the problem was showing here, right, in the lateral epicondyle, like the elbow. But the source of the problem was because they had very tight internal rotators of the shoulder that were pulling her forward like this. And because the thing was pulling her forward and all the tissue was being rolled forward, then that was putting a lot of strain on that attachment point, on that area. So I simply had to release, you know, those internal rotators, educate a little bit about, you know, rib expansion, improve the scapular thoracic rhythm, you know, kind of look a little bit higher. And I even asked them, I'm like, did this other person, the other physio, even look at the neighboring joints? And like, no, what did? They did everything to that elbow. So nothing else. No, they didn't do anything else.
Yeah.
So the thing is like, what got them into the door was the fact that I specialized. I was a tennis guy.
Yeah.
But it wasn't a tennis injury. It was just a postural problem, or it was a dysfunction in the tissue. So kind of going with what Dr. Ken was saying before is like, you know, get a specialization so that you can kind of have a particular niche, but also, you know, kind of understand that it might not necessarily be that kind of an injury. It might be from somewhere else, and just kind of figure out how to work through it.
So it's a great point you're bringing in, is that, you know, when you do have your specialization, always look beyond the injury, because there are these other things that will help set you apart. Because traditional education in all these industries can be very myopic at times. They're looking at they're looking at everything as an isolated segment, whereas there's a lot of opportunity to really stand out. And even through having this niche specialization, you might just get a whole bunch of general referrals, right?
That's right.
Which is great. Now, so I think that's a great way of kind of summarizing when you're finding your specialization. In your words of wisdom, look beyond the injury. Look at the breathing pattern. Look for things like scar tissue that might be interrupting the system. Look at how everything is fascially connected through the model Thomas Myers uses with anatomy trains. So bring in these different lenses and filters in order to help yourself be even more exceptional in your area of specialization. Now, I want to switch gears here for a second, because I'm not sure if you know this, and I never thought I would say this to you in an interview, but there's actually a worldwide pandemic going on right now. That's the reason we're talking like this. And what I think a lot of people may want to know, and what I'd like to know is, say, okay, what does the typical day look like for you now, and how are you adapting to this kind of new world that we're in? And how are you accommodating your business and your specialization and profession right now?
Okay, so first off, before I kind of give you sort of the story of how things have been for me, what I wanted to sort of just highlight is the fact that, remember, up until very recently, I was all about ART. I was all about grass needling, manual therapy. So my bread and butter came from using my hands, right? So can you imagine me calling somebody on the phone and saying, you know what, I think that you and I should have a session in which, you know, we chat, we go through some exercises, I teach you how to do exercises and self-mobilization for yourself. Can you imagine the challenge that would have been for me? Because they'd say, well, you know, I'll just wait until the clinic opens. I'll just wait because I really need your hands to work on me in order for there to be benefit.
Yeah.
The number one challenge was to figure out, how can I sort of let people know or convince them, but in a very honest way, that I can still provide some benefit. So and this is where I realized, well, I also have a bunch of exercises that I know. There's the Exercise Therapy Association stuff that you've created that will also help me, but I also have these other tools. So I knew that I could win them over, or I could convince them that I can still help them. Now, the first thing I had to let them know was that we're not gonna open up the clinic right away. So to say that you're gonna wait until the clinic will open, that could take months. So we need to make sure that we observe and educate and help this person throughout this pandemic, however way we can.
Yeah.
So that being said, this is what happened. So my family and I, we were away, just around March break. We had gone away out of Canada. We were in Costa Rica on the beach, relaxing while all this stuff was sort of happening. We made the decision to do it. I think it was the greatest decision for us. We came back, we self-quarantined for 14 days. And for the 14 days, I got to really enjoy my family. I got to really enjoy my relationship with my wife, with my children, just being in one area together 24/7. And that was something that was missing, because I was always going to work and they were always going to school, and we never see each other as much as we did. So that really kind of healed me in a way, for the fact that I knew that moving forward that I would have to, spend a lot of time away from them, but still in the same house, if you get what I'm saying. So then, while this was happening, I was also getting educated on what was called virtual care or telemedicine. And basically what that is it's a platform through, sort of this video and audio conferencing, where you just speak to somebody. It's kind of like what you and I are doing, but with a purpose. The purpose is to provide functional care for your patient or the individual who is also isolated in their home. So in order to do that, I had to learn about, these different applications on, I had to download them on my iPad and my computer. I had to learn the technical language of different things, and, codes, and how to join sessions. And if you know me, you know that I'm not very technical to begin with. So,
I think you use a typewriter still, don't you?
Yeah, I don't even have a desktop at home. Anyways, so that was a big learning curve. But, the organization that I work with, and the people, and they've spent hours and hours to put together these softwares, made it really user-friendly for me to be able to do it. So remotely, what I can do is I can access information so that I can, in a very confidential way, high security, to contact my patients and then say, let's sign up for a virtual care session. They usually run about anywhere from half an hour to 45 minutes. And basically, it is me providing care for them. Now, what does that mean? It means assessing their range of motion, assessing their functional movement with the standardized tests, getting them to fill out functional questionnaires, asking them to, go through certain movements, whether it's for strengthening or stretching or balance, and work with them, come up with some short-term goals, some long-term goals, and then just follow up with them. So it's basically what we would do in the clinic, but we are doing this virtually one-on-one. And there's a lot of benefit to this virtual care, because even when this pandemic is over and we have people that are back to work and I'm back in the clinic, then they may have a really tight schedule one day where they only have half an hour. And for the amount of time it takes them to drive to the clinic, get their treatment, come back, they might just say, let's do a virtual session for that time period. So that is the way of the future for our industry, I believe, that that virtual care has to be part of it. Now, is it perfect? No, because we're new to this. There are countries that are using virtual care. Australia has got these great researchers. We've got researchers in Canada. We've got a researcher in Quebec that's been putting together a lot of things with virtual care. I've been educating myself. So these are the ways that we can help people kind of get through their critical illnesses. Now, the other advantage that I'm learning is that you can also tag team, like you can have more than one practitioner or one provider on the session. So I might have the client with me, and then I can work with them virtually, but I can also have an exercise therapy association trainer alongside giving their input. And we can have kind of this common session where we all want to help each other out, where we want to clients.
That is an amazing point, because I remember one time back in 2003, I was taking a muscle testing course, and I remember Ken Kanakin talking about this concept of trainers going and actually going with the client to see the therapist. And I decided to apply that, and I would join my clients when they'd see a chiro and a physio or an osteopath, and I would sit in. And for me, it was so educational to understand more about what these people are doing. And in a way, I was able to get more information to know when to refer out. Because a lot of times you need to know a certain amount to know when to refer out, because you're recognizing a problem. And I built a lot of great professional relationships that way. And it really accelerated my knowledge. It accelerated client results. It really made everything move forward. But the one limitation was for me to actually travel, get in my car and drive and meet my client at some therapist thing. It took way too much time out of my day. So as much as I valued it, it wasn't always practical. Right. But you know, what you're saying here is an excellent point, that this has always been an ace in the pocket to join your client on a therapy session, because it shows that you really care. Like if you actually care enough to just sit in on the client session and be like, yeah, I just want to do a good job, then it's going to really set yourself apart. It's going to help build those connections. I also, on a mental toughness level, feel like it's great hygiene for humility, because one of the biggest things that I think limits people in their health careers is ego, and trying to think you can be that go-to for everything, and not really knowing when to refer out, not really knowing when to admit that you don't know, right? And I think this is a great opportunity to practice humility and strengthen your wisdom and everything else. So that's an amazing point. I'm glad you brought that up.
No, thanks again for summarizing that. And it's true that, you know, being able to be sort of like client focused or client centered is really how our industry need to work together on and focus on. And it will help everybody in the future. I've helped so many people, you know, in all different disciplines. I've worked with chiropractors, osteopath, massage therapists, acupuncturists, kinesiologists, personal trainers. I respect them all. And, you know, I mean, and everybody brings some kind of knowledge and learning to me. So I'm I'm like a sponge. I like to constantly learn what they're about. So, I mean, like rule number one, you know your audience. It's like, you know, if I'm working with somebody and, you know, they're a patient and they have a particular interest in pottery or something, you know, I need to know a little bit about pottery so I can have that conversation with them, so that I know that they could feel comfortable with me working with them, you know, from a physiotherapy standpoint. You know, if I'm having a conversation with a dentist, you know, I want to have a little bit of knowledge about teeth so that I can have some kind of a conversation with them so that they know that I'm interested in it. If I'm working with a personal trainer, I need to know, you know, what these different, you know, exercises are called and how they work. If I don't know that, then I really don't know much about, you know, who I'm working with and the profession that we're working with. So that's really key, you know. So these are the really important things that are very important. I think that continuing education is key. I'm continuing my education with the virtual care. I'm part of a committee, an education committee, in which we're putting together videos to provide for our patients, to provide for other health practitioners who will be going through virtual care. I invite anyone who's out there and part of the exercise therapy team or practitioners that want to provide some cool exercises. You know, we can work together and for the benefit of these patients. If we have to come together and do some video conferencing together, we can work that in somehow. You know, we're all in this together. This is what we always hear, right? And we need to find ways to help the others get better. But also at the same time, we also need to feel satisfied that, you know, we're also helping each other out, not just the individual.
That's awesome. And I know that one thing for everyone to look forward to, Ken Kanakin is creating a Facebook group to kind of bridge the gap between all these different health professionals right now. That will be coming out soon. So I think we can all keep an eye out for that. Now, I just want to switch gears here a little bit. So some excellent wisdom and insights on, the virtual world. And for all those who are in the chat, just let me know if you do have any specific questions you want to bring up. Other than that, I wanted to ask you to speak a little bit about finding your niche and mixing your passion with your profession and kind of becoming more that specialist in tennis. So if you could maybe share a little bit about your learning journey, some of your struggles and successes that you experienced on the way that I'm sure many of our viewers will likely come up against. And then if you could just share some of those wins and losses you experienced and what you've learned in the process, that would be appreciated by all of us.
Right on. So as I said in the beginning, my first sort of meshing of physiotherapy and tennis was when I was a tennis athlete and I had injured myself. It wasn't from a tennis injury, but I was playing competitive tennis at the time, and injuring myself and being exposed to physiotherapy at least got me back to tennis, but it didn't get me back to where I wanted to be at that moment, right? Mm-hmm. Unfortunately. But they got me into the profession of physiotherapy. And I knew that as I continued my career in physiotherapy, that I wanted to have some relationship with tennis in some capacity. So in my early years of being a physiotherapist, I continued to play tennis, not at a national or provincial level, but maybe more at a sort of a regional city level. I got into teaching more tennis. I got my certification to teach. So I was teaching people in the community. I was teaching, I kept going with my certification to help teach people at more of a higher level. And so it was kind of nice because I was able to work, spend most of my day as a physiotherapist. And then after that, teach tennis to, people in the community. So I had these two passions, right? I was extremely busy. I had no real social life, but, in the beginning stages of it, it worked nicely for me.
Yeah.
As I continued with my sort of tennis teaching and my physio, I had to make that decision. And I had to say, which one at that moment weighs a little bit more value? Is it the tennis? Is it the physio? And I had to step back from the tennis and say, I have to focus more on the physiotherapy side of things. I need to kind of help people from that perspective, but I don't want to let go of tennis. So then I got into what was called facilitation. So I spent some time learning and getting certified so that I could then certify people to become coaches, right? And when I was able to do that, then I could eventually take offers of hiring people to then teach at the clubs where I was teaching, right? Definitely no conflicts of interest. I would certify them, they would apply for jobs. I would leave it up to the executive to hire them if they felt that they were good. And then we had some workers that were working at the tennis club. So that also helped the community because we had more people that were able to teach. So I was helping from that perspective. So that was still my continuation of my physiotherapy and then with my tennis. And then I took it to the next level. I said, well, how can I kind of work as a physiotherapist on tennis players more at a higher level? And with my great connection with, the different tennis clubs in Ottawa and the high performance programs that the different clubs had, I was able to tap into that market and work with those high level juniors for physiotherapy. And I was very objective. There was no kind of like, I'm going to help this team, but not that team kind of thing. It was all kind of like, if you have a player who is a high level and needs physiotherapy, send them to the clinic, which is exactly what happened. So I was getting high level players from all these different clubs coming into the clinic and getting physiotherapy from me. And these are people, imagine, that were normally used to seeing each other on the other side of the court, on the other side of the net as adversaries. But in the physio clinic, it's like, well, there's Arthur's clinic, we're all getting healed by Arthur kind of thing. So that was a great opportunity for me. So what I really found was that, having that interest in tennis, and of course, having the profession as a physiotherapist, finding ways to keep the two of them together was a challenge because I would either have to teach or I would have to facilitate, or I would have to actually treat players while working as a physiotherapist. But I mean, it all figured out, it all kind of worked out in the end. One of the highlights of my career was we had the Davis Cup in Ottawa. So we had Team Canada versus the Team Great Britain come in, and they played in Ottawa. And I was very fortunate to have been the local physiotherapist for that tournament. And
Wow.
one of the highlights of that kind of tournament was a game changer for one of our Canadian players. There's a guy named Denis Shapovalov, and he was a tennis player. And that was the tournament where he kind of had a fit. He took the tennis ball and he whacked it, and it hit the referee right in the eye.
Yikes.
You can YouTube search that. But anyways.
I probably will.
But, without going into too much detail of sort of the aftermath of things, what I can say is that was a game changer for him in terms of after that moment, after that embarrassing moment, that he changed his attitude. He became more mature on all levels. And it showed, because later on he ended up doing well in the Rogers Cup. He did really well in US Open that same year, and he continued to grow. So from a growth perspective, that really helped. And had I not been involved in tennis, had I not been involved in physio, I may not have never been in that place at that moment, right? So what I'm saying is that when you are passionate about something and you have a profession, mesh those things together in some way, shape, or form, your path will be determined. And whether you realize it or not, it will happen. But what you have to realize is that the people you meet along the way, the things that influence you to either go straight, turn left, turn right, those are all happening for a reason. You're going to make mistakes. You're going to have to turn around. You're going to have to, take time to reflect and start back again. But in the end, you will be heading in the right direction. And for all of those who maybe don't know how to find that passion, like I remember when there was a viewer that was asking Dr. Ken, like, how do you find your passion? And he's like, what do you watch? What do you read? What are you immersed with? Well, those are the things that will help you determine what your passion is. But I'm going to also say this. You're going to also be very surprised that you're going to think that is your only passion, but you need to look outside and that you're going to develop more passions. Because if that one passion that you're so passionate about fails you at some point, you have to know that there's something else that you can fall back on. There are many. I'll give you an example. I'm so passionate about tennis. I'm so passionate about physiotherapy, and I'm working really hard to go in that direction. But I'm going to be honest with you. In the last month, I'm so passionate about playing Beyblades with my kids. I'm so passionate about setting up the cars. I'm so passionate about just learning how to be on the computer and setting up Google Classrooms. If I'm not passionate about it, then how am I going to succeed? And the other thing that I want to make very clear to everybody here is that your passion for your profession and your passion for whatever other activity that it is, that is important, but that is only a part of your passion. You should be passionate about yourself. You should be passionate about your partner, your spouse. You should be passionate about your faith, if you have one. You should be passionate about yourself and your household first, right? And then your community, and then the world. I know you kind of made this really cool depiction of that, but you have to recognize that the people around you that support you in what you want to do, that will be there to lift you up when you fall, are the ones that you have to be passionate about. And I know that you've made it very clear. We talk about the love languages, and we talk about how to effectively communicate with the people around us. Well, I've been using that application naturally, over almost 2 decades of my relationship with my wife, or with our children, or with my friends. But then I'm also applying that in my practice. It's like, how can I communicate effectively with my patients, in the way that best suits them, that they can understand. So having a passion is very important, but having a backup plan is also very important. Because if you don't have a backup plan, You know, you could fail, but that's okay, because there should be somebody that you're also passionate about that will be there next to you. And the other thing that I also found really passionate about over this last month, despite what's going on, is that when we are isolated in our homes, what happens to our world, right? We become the top of our world, because we only have to deal with the people inside the house. I mean, we can deal virtually with everybody else, but I don't have to take a step outside and feel that now I'm competing against the world. I'm in my own home. I'm in complete control of what I can and cannot do. And, you know, I'm going to take care of my health. I'm going to take care of my spouse. I'm going to take care of my loved ones. I'm going to take care of, you know, everybody that's in this building of mine, in this home of mine. And then when I know that I'm doing well for myself, then I can branch out and I can help people virtually. I can wave to people on the street. I can smile at them, right? I can, you know, I can encourage people. So from a philosophical perspective, this is something that we can do. But if we do not improve ourselves first, how can we be true to ourselves and helping others in a way that they need to be helped?
So I'm going to, first of all, I thought that was absolutely amazing, everything you just said. Phenomenal. Absolutely. I feel like we could just snip that and that could be its own little video segment. Probably get like a couple million views. One of the things I want to talk about, just to kind of paraphrase some of the things you said there, you know, one of the things you talked about was trusting the process. You might not see the path before you, but you just trust the process, that when you decide to commit to your passion, that opportunities will show up in unpredictable ways, and you'll never know how it's all going to connect. So I think that was a really good message. The other thing that you talked about is, you know, you want to be able to not use those external passions as a distraction from fixing your stuff at home and fixing your stuff with yourself. Because, you know, you'll see a lot of people who will totally throw themselves at helping out the greater world at large and all these other bigger concepts. Well, meanwhile, everything is falling apart at home and everything is falling apart within their own self-esteem and everything else. And they're just using it as a compensation. So I think it is a great point that you really want to create a niche at being awesome at home, and then kind of let it build out from there, right? It's right. Got to start from inside out and stuff like that. So I think that's an excellent process. Now, I wanted to just throw a couple of questions at you here. We have a question. What is the best way a chiropractor can approach and work with a physiotherapist?
Oh, that's an excellent question. You know, for sort of like this kind of, there's this mentality that, you know, chiros do their thing and physios do their thing, right? And those are more like the traditionalists. You know, it's like physiotherapists do their passive modalities and exercise, and the chiros do their adjustments. But as let's say Dr. Ken Kanakin was saying, like his title is chiropractor, but he does much more than the traditional chiropractic stuff, right? Yeah. And my title is physiotherapist, but I do so much more than that as well. So I think in order for chiropractors and physiotherapists and massage therapists to kind of get along, is to join these kinds of forums and discussions and you know, networks, and also just go online and read up on the profiles of the physiotherapists or the chiropractors, and see what other courses that are being taken. Like the active release course that I pushed for, it was developed by a chiropractor, right? And I think I've done Aston technique also by a chiropractor, you know? So I've taken some other physiotherapy courses, but in order to make that connection, if you want to do it locally, you know, you can easily go read the reviews of the, you know, Google reviews or Facebook reviews to see, you know, how the performance is of that practitioner. But then also, you know, just pick up the phone or do a video conference call and say, listen, you know, I kind of work in your area. You know, maybe we can collaborate together, and we can, you know, maybe we can have some cases that we might be able to help people with. And, you know, I want to pick your brain with certain things. I mean, I've done it. I've had people ask me, like, why are you even calling me? Like, I have a chiropractor that works right in my clinic with me, and I have a lot of respect for him. But I also have a chiro colleague who's just down the road. And there are some cases where I say, I want you to see that chiropractor who's down the road. And they'll say, well, why? You have a chiropractor who's right in here. I'm like, yes, but I feel that the other one will be giving you more benefit. Well, how do you know that? Well, because I've seen this gentleman, I've worked with him, we've shared patients together, you know, back and forth. So to answer the question specifically, is how does a chiro kind of reach out for a physiotherapist? Is look to see the experience of the physiotherapist, look to see the credentials. It should be outlined in their bio on their website or the company's website. You can simply pick up the phone, give them a call, and see how you guys can you can collaborate. I think that would be the starting point, and then from there you can just decide after that.
That's an excellent point. I know for myself, a lot of times when I meet people from different disciplines, I've met them at educational courses, and I found that, you know, you find people who you tend to gel with most, like the people who are most passionate about learning, that are the ones you connect with best, and they end up being great referral sources and networks and stuff like that. So I found, and I know with you, it was really unusual how we connected, because you had met some of the students who took exercise therapy, you saw their sheets, and then got my contact info to reach out to me, right? So it was kind of, it was really, but it was great, and I'm glad you did, because now we're good friends and everything else. But it was really like, you just like, hey, give me the contact info, I'm going to reach out to this person, right?
Yeah. So you know, we have to find ways to you know, to learn and to help each other out. And I think that it's really important to have an all-star team. But you can also look at those specialities. You know, so for example, if that chiropractor had a special interest in tennis, and they wanted to work with tennis players, then they could reach out to me, because I have an interest in tennis and I happen to be a physiotherapist. So then we can network that way. How many
chiros do you know are specialists in tennis that you know
of? Maybe not many.
Okay, how many trainers,
if you're out there? Sorry?
How many trainers do you know are specialists in tennis training?
Maybe one or two, not many, unfortunately.
So not many. How intense is the competition for you being a physio that specializes in tennis? Is it like a dog fight out there, or is it generally pretty open?
Well, I think that at this moment, I think that I've pretty much monopolized the industry for tennis.
Okay. So I think.
However, that being said, is that, I mean, I've been in the profession for 20 years, and I've you know, and I've worked with tennis players who kind of like, hey, physiotherapy looks like a cool thing to get into. So maybe they're physiotherapists who have you know, experience in tennis. So I'm reaching out and I'm inviting anybody that has any special interest in tennis, whether you're a personal trainer, and it doesn't have to be tennis, it could be all racket sports. So one of the big things that I did, Brendan, I forgot to tell you, was that I had the opportunity to speak back in 2013 at the Canadian Sport Medicine Conference in Toronto. And I mean, I had about, you know, 400 or 500 sports physicians all across Canada come in and listen to me lecture about racket sport injuries and how to remedy these injuries. And it was one of these really cool presentations. It was back in 2013, and I used the platform Prezi. I don't know if you've heard of it. Prezi?
Not familiar with it.
Check it out. Anyways, what it is was, it's like kind of like these really cool little slides. So it's better than just your basic slideshow presentation. It's more interactive. Anyways, so after this presentation, and imagine this was after lunch. So all of them were starting to get a little bit tired, and, you know, so I had to make it really like energetic and enthusiastic. So I had this awesome, you know, well-received presentation I did on tennis. So I had all these doctors come up to me after the presentation, and they come up to me and ask me all kinds of questions. And you think that I would think that they were asking about, you know, how do you cure tennis elbow, or how do you, you know, fix rotator cuff? And all these doctors are asking me for free advice on fixing their backhands and their serve techniques and forehands. But anyways, I think in answer to your question, they're not just tennis and racket sports, but you know, a lot of the trainers are getting more into the weightlifting and the powerlifting, you know, and you know, things like CrossFit and all these kinds of things. But there are other sports. I mean, you take tennis, dance, ballet, you know, all kinds of other sports out there that you can develop a niche. I know that there are some therapists who specialize in dance because they were once dancers. So they'd work with like the ballet of Ottawa, the National Dance School of Ottawa. You know, we have some, you know, obviously we have the ones that are part of the contact sports, you know, like football and baseball and hockey, but not a huge niche in tennis, I would say. So if you're out there and you want a network, let me know.
That's a really awesome point because, you know, when people do decide to find their voice and clarify their voice and specialize, you know, your example is one of many that Ken had mentioned to us that nobody's going after these things. It is just wide open. So, you know what, you could pick a specialty. Let's say you're like, okay, I want to be the volleyball therapist, right? Like, that's it. I want to be the volleyball therapist. Literally reach out to everybody and tell them that's what you do. And you're probably the only person that they can think of when the next time when a volleyball player comes to them and has some sort of problem they need help with. Right. Like, who else are they going to be thinking of then? It's really like, it was such a powerful message to just find your niche because, you know, I mean, right now, if I think of tennis, if I ever, you know, through word of mouth or anything like that, if I get some sort of a star tennis player in my roster, I'm actually going to make them do a session with you regardless. I'm going to say, do an intro session with Arthur. Even if you don't have an injury, he just needs to understand you and everything else and kind of see where you're at. You develop some sort of a baseline so that when you do have an injury, he's ready for you. You know, like if I get a star tennis player, that's what I'm doing because, you know, not only because of everything exceptional about you, you know, but there's also just the fact that who else is really going after that specialization, right? You have no competition in that area. Not to mention the fact that I think you're brilliant at what you do. I mean, but it just proves the point that, you know, if you trust in the process, you'll find that the path will clarify itself as you go. Because in many ways, it's not as scary or treacherous as you might think at the outset. That one thing you don't have to worry about is competition, really. Like in any of these things, right?
That's true. Well, thanks
so
for that.
Kudos to you on that one there. So just to summarize for those who have tuned in, I'm here with Arthur Cuenco. He's a master physiotherapist. He's been doing this for 20 years now. He's taken virtually every course you can think of, whether it's Graston, ART, active release, all the rest of it. He is indirectly involved with coaching, mentoring, and educating a team of 200 physiotherapists in the Ottawa area, right? And, you know, some of his big messages today were to look beyond the injury, look at the person, not the injury. Because when you look at the person, you're going to find clues that may be overlooked. A clue that could be overlooked is a sympathetic nervous system overdrive due to scar tissue from a past injury. If you don't even ask about this stuff, you can't find this stuff and help with it. You have to find it to fix it, right? Another example is just the breathing pattern, diaphragmatic breathing versus inverted breathing. The way somebody breathes will affect their hormones. It will affect their physiology and it will affect their healing rate. If you just look at the injury, you could miss this. And breathing pattern could be off for a number of different reasons. It could be mental, emotional. So you need to keep these things in account when you're working with somebody. And another thing is that the muscles aren't just these isolated little mechanical things in your body. They're like sausage links. They're all connected, as was made popular by the anatomy trains model of Thomas Myers. So you need to look at how something may be connected to something way further up the chain. And the site of pain, as Arthur said, is not necessarily the cause of the pain. So you've got to look at the whole person to understand these things. And if you bring these different perspectives into your area of specialization, you're going to stand out because this is not mainstream education. This is not how people are taught to learn. People aren't taught this way of looking at patients in school. So if you just bring in these different perspectives, you're going to have an opportunity to stand out. The other thing Arthur talked about was this whole idea of doing virtual training now. that it's going to be not just a temporary thing. You're going to have patients, once we gradually and gently get back to in-person meeting, you're going to have patients or clients that may not be able to make a session, but now a virtual session is a more accepted option because people are going to have greater familiarity and comfort with it, and you're going to be even better at it. So it's going to be a service offering from this point forward. So it makes sense to just learn what you can to be as proficient as possible at that. And it also brings in a great opportunity to be able to network and bring other people onto your team. And you can do this and you can meet with a client. You can have a whole network of people on this virtual session, you know, and just a whole round table of experts there. You can definitely network and take advantage of these opportunities through virtual offerings. And then the last thing, you know, you were talking about just finding your niche and bridging the gap with your passion and your profession, not forgetting that the first place you need to succeed at is locally within your home and within yourself. And then from there, focus your passions outward, because otherwise you're distracting yourself from what's most important ultimately in your life. If you succeed at work, but you fail at home and you fail within yourself, is that really success? I think there's a lot of examples of rich people that have been miserable and killed themselves because they followed that model. Arthur's encouraging you to follow a different model of succeeding at home first. And then he's saying, you know, trust the process. That if you just commit to this, opportunities are going to come up. You're going to meet people. You're going to be in the right place at the right time. There's not a lot of competition out there for this kind of stuff. It's going to be really easy to have people view you through this lens that you're this person of this specialization, because there's not a lot of people really specializing in this way. So you're not going to have, people aren't going to be confused. It's going to be very easy for you to stand out. And it's going to be very easy for you to reach out to others, chiros, physios, trainers, and make that connection and let them know, hey, here's who I am. This is my background and this is what I do. I focus on people from this niche population. So, you know, let's create some opportunities to work together if we can. So I think that that kind of summarizes a lot of your, did I miss any of your main points there, Arthur?
No, I think that you've got, you kind of hit the hammer on the head there. We also have to recognize that we are all in it together, that we do have specialists, that we have to look out for the rookies. We have to look out for each other. And we have to recognize that, you know, that we can always learn. And even if we're making mistakes, we can always kind of improve. There are two kind of quotations that I'd like to read out to you that I think really kind of help to summarize our current situation and how we could potentially deal with it.
Absolutely.
And they're kind of philosophical, but it's kind of nice. And there are little magnets on my fridge here. The first one is, just when the caterpillar thought that the world was over, it became a butterfly.
Awesome.
And the second one is, life isn't about waiting for the storm to pass. It's about learning how to dance in the rain. So these two things, I want everybody who's listening, and I appreciate everybody to spending their time, you know, with me and Brendan and listening in, is that my life experience over the last 20 years and beyond has helped me become the person who I am today. Am I the perfect person? No. Am I the best physiotherapist? No. But do I want to keep getting better at it? Of course I do. But why? Because I want to be a better person. I want to be a better human being. I want to be a better father, a better husband, a better friend. And I hope that people can kind of ingest a little bit of my philosophical kind of teachings to understand that we have a profession. We have a job that we have to do. But that job can be taken away for us. Just like that. And it has. And how do we pick up the pieces and move forward? How do we take this tragedy or, you know, the shortcomings, and how do we turn it around? And I guarantee you, each one of you will find a way to realize that there is a good in what's going on. And that goodness is that it's bringing you and I together. It's creating this conversation. it's creating this dialogue and letting people listen in. And I'm really looking forward to listening in on future talks from other presenters and listening to their insight on how they're dealing with the crisis and how they're dealing with their professions and their passions. And I really, I'm thankful for this opportunity to have met you and also to have been able to speak. So thank you so much for this, Brendan.
Well, and Arthur, I think I speak on behalf of everybody when I say that we're just overwhelmed with gratitude for you taking your story and sharing it with us in a way that will benefit us. That you've graciously taken your journey and you're like, here, I'm going to give you all the golden nuggets so that you can go out there and be excellent at home and be excellent in your profession. And I know that one of the first things I'm going to do today, once we end this call, is I'm going to reach out to a rookie. I'm going to answer the call on your challenge, and I'm going to reach out to a rookie for no other reason than just supporting them and giving them any wisdom and experience I can, because that's what makes the world go round, people helping people. And I think you've been a great inspiration on that today. So once again, for all of those who are watching and listening in here, you can connect with Arthur Cuenco. What's the best way for people to connect with you if they're looking to?
If they want to reach me, they can get me at arthur.cuenco@gmail.com, and then I'll be joining the Facebook group with Dr. Ken Kanaka.
Perfect. So yes, I would say definitely put this guy in your back pocket, have him in your network. He's an awesome guy. I can definitely speak from experience. He's definitely somebody you want in your alliance and part of your heroes guild for your life journey. So I would definitely encourage you to connect with Arthur if you haven't already, because we're all in this together. And Arthur, thank you very much for your time out there today. Thank you, everybody that tuned in.
Thank you so much, everyone.